Hi, my name is Dr. Aram Elias. I'm a board certified dermatologist and I've been in practice for almost 20 years, raised 3 children, and I have a lot of practical experience and expertise to share with you, as well as just medical based knowledge that's based on having seen tens of thousands, well over 100,000 patients in the past 20 years, to really share with you not only both the expertise, the experience, the literature-based knowledge, but also just practical advice. You know, what you need to know to navigate your skincare needs that makes sense, instead of just loading up your counters with tons of products that end up in a shoebox afterwards. So we really want to make sure you understand why you get what you get so that you can make more informed decisions. So subscribe now and keep up with our videos. This is so interesting because there's not a lot of regulation around some of the words that you might see on products, and they lead to a lot of misunderstanding or misinformation as to what you're getting out of a product. The first product claim I want to go over is the difference between these terms, maximum strength, clinical strength. This comes up a lot and is very frustrating from my perspective because sometimes patients will come in having tried a product that has that verbiage on it from an over-the-counter product, and they'll just assume that they've already maxed out their opportunities to treat whatever they were trying to treat, and either there's no other option available to them or they just can't imagine I can help them. I also worry that sometimes people will think they've already done what they could do and there's no reason to see a doctor. I mean, I worry I haven't even seen those patients, so they haven't even had the help that they need. So really understanding these terms is essential so that you make some more informed decisions about what that means for you. So maximum strength refers to concentrations of an ingredient in your product that may be higher than the regular strengths offer, but it doesn't necessarily have to be the maximal amount of that ingredient available either over the counter or by prescription. This can be frustrating because, again, you might think you've maxed out your options, but there could be other options beyond that point. Some of the real-world examples of the use of the term maximum strength seem to come up in antiperspirants and in acne products. Antiperspirants will often reference maximum strength. So you go and you get it and you think, okay, there's got to be nothing else better than this. So if I'm still sweating afterwards, then I'm kind of stuck with sweat. When the reality is that sometimes what you'll find in maximum strength products is either it's more, the ingredient that you're getting is a little higher than what that product line might normally offer, or you might be getting an ingredient that is just slightly higher than what they offer, just it's based on their regular strength. But the reality is, again, that there's probably prescription options that are stronger or different ingredients that can work better for your particular needs. So when they say maximum strength, they're only referring to the concentration of that ingredient, their active ingredient, relative to other products in their line possibly, but not maximal strength ever. You know, they're not talking about this is the highest strength you could ever get out of your antiperspirant. I worry about this with acne products. A lot of acne products will say maximum strength acne treatment. And again, you're maxing out the over-the-counter ingredient potentially, but gosh, the over-the-counter ingredients don't even compare to the prescription options. And if we have kids out there that are treating their acne thinking, I tried the maximum strength, there's nothing better than this, then I really worry, because of course we have other options and better options that are more suited for your skincare needs. Now, clinical strength. Clinical strength seems to refer to the maximum amount of that active ingredient as available by over-the-counter options, but not necessarily relative to prescription options. So again, it might actually imply that you're getting pretty close to it, but not quite there, but you're not necessarily maxing out your options again. So clinical strength you'll often see on things like antiperspirants and deodorants, and that always worries me again because I have a lot of patients over the past 20 years who have come in and been a little shocked that they can even do something about their increased sweating. Also remember, when it comes to terminology like maximum strength and clinical strength, is that these are not really well-regulated terms. And it really, probably the only thing we can say about them is that these strengths or these concentrations are probably some of the highest you can get over the counter, but not necessarily as prescription. And also know that when you're using them, it's relative to the ingredient in there, but not relative to the disease that you're treating, or condition that you're treating. So if you're treating acne, for example, and it says maximum strength, that isn't the maximum strength of anything available to treat it. Of course, we have other options beyond